Sawadee Ka. My name's Kristen, and this is Tenny's SRS blog, part 1. Yeah, my nickname is Tenny. I'm having my surgery in Bangkok at Nawamin 9 Hospital, and my surgeon's name is Dr. Titi Chawannalikit. So I will start by telling you why I chose my surgeon. When I first arrived in Thailand, I'd heard of Dr. Supon, and he had a good reputation, but it's rather expensive. One thing I can say is that it seems like Thai surgeons, they put up their price by 10% or thereabouts every year or so. So when I thought about saving for my operation, his prices were rather out of reach. So then I had some students, I teach English, I had some students who were the support team for the cosmetic surgeons and the SRS surgeons. They were based in one particular hospital, but like the surgeons, they do move around. They don't just stay in one place. So my team was the anaesthetist and the helpers for the surgeon. The assistants, that's the right word, yeah. They recommended Dr. Chetterwood. He is less expensive, and they said he's very nice. So as they worked with surgeons, I thought that they would be, good inside information there, eh? So Dr. Chetterwood is kind of got my seal of approval, but again, as his prices increased over the years I was saving, he also was out of my reach, and I was starting to really despair. But then I heard a friend of mine. I went shopping and I met a friend of my friend, and she had had surgery with Dr. Titi. And I as we went about going from shop to shop, I asked her, and is he good? What's the results? Is it beautiful? Are you sensate? And she gave me a very good idea about this surgeon. So I started saving because he was affordable. And I wasn't sure. I thought, do I continue saving a few more years and go for Dr. Chetterwood, or should I go with Dr. Titi? But then, just as I was getting enough saved for Dr. Titi, another friend gave a good report about the results. She just said, yeah, he make pussy good and work good and beautiful. So, having two good recommendations and having the correct amount saved, I decided to go ahead and make arrangements. So I called the hospital and made an appointment to see him. When I met him, he was very nice, and I'd heard that he did humanitarian work, helping poor people with cosmetic surgery, people that really need it, like people with a hair lip or what have you. So that impressed me, and when I spoke to him, he was very informative, he was very kind, he was telling me about his technique and how he would make decisions based upon the patient what was actually happening at the time, and also interestingly he would select donor material according to the required colours, like a palette, which I thought, yeah, I can see that. It's kind of an artistic procedure too. So he helped me understand, and in the combination of a really nice hospital with helpful, friendly staff, the nurses were great, and just a very good feeling. So he told me I needed to stop my hormones, which I did. I needed to get reports, physical and psychological reports. The first one, a physical exam, was expensive. I went to a hospital where the Westerners go, and Arabs, rich Arabs. So it was very comprehensive. I was checked out completely. Heart, blood pressure, blood sugar, and it all came back 100%, apart from mild hypertension. Like my blood pressure was just a tad high, so they gave me some medication for that. And the psychological report, I did go to another hospital, which I can highly recommend, because the price was much more affordable, about a third of the price. So I'd highly recommend going to Rama 9 Hospital for your reports. I really liked the doctors there. They were very friendly and helpful, and it was a breeze getting my psychological report. So I'm making this blog to tell you about my journey, and I'm just 2 weeks in, waiting on a date for my surgery. I communicate with my doctor on line application. I'm rather impressed with that. He doesn't pick up the phone, but he will text you when he's not too busy. I like communicating like that. I appreciate that. Also, I feel a little bit, what's going on? Yeah, I stopped my hormones, so I'm a little bit tetchy, a little bit bitchy even, but I'm also noticing I'm really impatient. I really want to get this done. So what I'll do, I'll keep you informed of my journey, about the lead up to the surgery itself, the aftercare. So it's 5 days in the hospital, and not sure exactly how long, about 3, 4, maybe even another 5 days in a hotel really near the hospital. So the doctor can check me out. He can teach me how to clean my new lady garden, and also how to dilate, how to stretch the vagina so that it becomes large enough. I've actually encountered one that had not been dilated, and I tell you, it's not good. Dilation is important. So, okay then, I think I've covered part 1 of Tenny's SRS blog. So I will say bye for now.